Hello everyone, this is Lisi again. Today is day -4 of my preparative regimen. Yesterday was day -5, and on day -5 I received a new chemo drug in addition to the fludarabine that I've been taking. This new drug is called Thiotepa. I like that name, Thiotepa. I do. Well, Thiotepa came with a few instructions, mainly that I have to take a shower every 6 hours, if not more often. And that's because the drug is actually secreted through the skin, right? And doctors don't want that secretion sitting on my body for so long, because then that causes bad reactions because it's toxic. Yeah, I might get a rash, or my skin might start peeling. Ew. So I'll take as many showers as I need to. And also the staff here has to change my linens after every shower that I take, and the nurse also has to change the dressing on my my line here to get clean under this area, because in the shower I cannot just peel this off and put water on it. No water. This cannot get wet ever. It's like a hole into your soul. That's kind of scary. But yeah. And they can't use the normal dressing that they use. That's a lot more adhesive, and around this insert where the line goes into my body, they usually put something called a biopatch that's impregnated with some alcohol, really strong alcohol. And yeah, this is a little bit more flimsy. I'm used to the other one, but she changes it so often, so it's gonna stay there, because it's gonna be a new one every few hours. So yeah, I started Thiotepa yesterday on day -5. It has to go on for 2 days, so this is day 2. And once I'm done with the last dose of Thiotepa, I still have to keep on taking lots of showers for the next 36 hours. So I'll be squeaky clean for many days. Even I take showers, but not every 6 hours. Or actually, if I sweat an hour or two after already taking a shower, I have to go back into the shower and clean myself off of all the sweat that's probably mixed in with the toxic chemo. And yeah, that's what I've been up to. I like to show you my nice breakfast that I take every day, and my drugs. This is a new drug. I don't know what it's called, but it's protect my liver. These 3 I've taken since getting diagnosed. Yeah, those 3. They're called Noxafil. That's the brand name for it. The other name, I forgot. It's a long name. And this one is acyclovir. I've also been taking it since I got diagnosed. They're an antifungal and an antiviral. This here is Pepsid. Many people take this. Protects your stomach lining. These 2 here I take every time I have chemo, and it's called dexamethasone, and protects against inflammation. Inflation, that's something completely different. Wish we could protect against inflation, but whatever. It protects against inflammation. And soon, on day -3, which will be tomorrow, I start taking immunosuppressant drugs, which will be responsible for suppressing my immune system prior to day 0, which is when I'll be infused with my new cord blood units. And the reason why they have to suppress my immune system is because they want the new cells to, have a nice new home without any trouble. Although it's more likely that the new stem cells will actually attack my body because they're coming into a whole new home and they don't know where they are. But a little bit of fight is good, the doctors say, just not too much, just enough, not too much. And once the cells have acclimated to my body, what the doctors call engraftment, then that will be a success. And that is the goal, for my new stem cells to engraft into my body, become one with me, and give me a new life. And on day 0, I will be reborn. Yeah, so that will be my new birthday, which is actually also my birthday, the day I was born, back on December 5th, 1987. So yeah, I'm not that young, even though I look like I am. The nurse practitioner today was like, "How old are you?" "You're like 25, like 22. No, I'm not. And I definitely don't feel like I am 22. Yeah, I feel old. So yeah, that's what I've been doing on this past few days. Today I will be receiving more chemo later on around 3 o'clock. And my plan for the rest of the day is to get to walking around. I met 2 new people yesterday, 2 new patients. I usually don't make friends with the patients for some reason here. I guess I've been too down the last couple of hospitalizations I've had. Most of them, I didn't look forward to them. This one I was looking forward to. I was dying to come in and get my new cells. But yeah, I've made 2 friends last night. One, he's a painter, and I want to learn how to paint. He likes to dance and paint all at the same time. The other is recently diagnosed with APL, acute proliptic leukemia. I think it's proliptic, something with a P. And he was actually diagnosed on Halloween night. He was just walking about, and all of a sudden he felt like he was 90 years old and he couldn't barely walk. And luckily he was with a friend that told him go to the doctors, and that's when they ran a blood test, and they were like, "We can't help you here." It was a small hospital, and they sent him here. It's a very good hospital. So I'm glad he's here, and hopefully everything goes well for him. So yeah, maybe I'll find them on later in the day and chat a little more. It's good to have someone to chat with, make the days and hours pass that much faster. So that's it for this video. Next video will be about this calendar that I keep looking at and don't show you. I think every patient who's going in for a transplant does get their own schedule with probably a different combination of drugs depending on what you've been diagnosed with and your health history and your age and a bunch of other stuff. So I'll show you that, and maybe I'll do another video about my new digs, my new room for the next 5 weeks and a half. Hopefully it's only 5 weeks and a half. I'm gonna do everything that I can to get better soon. My grandmother would like that. Maybe get discharged early. Yes, that's the goal. That would be awesome. And yeah, that's it. I'll see you next time. Thank you for watching.